What is the cost if we don't? And like we talked about earlier, the healthcare costs, the cost to Cobourg taxpayers in terms of policing, just the sustainment cost for an individual living homeless is just insane. And so if we're going to spend that money, spend it on something that will help solve the problem instead of just sustaining. It's going to continue to get worse.
For Rebel News, I'm Tamara Ugolini here in front of the Northumberland County headquarters in Cobourg, Ontario. And I'm here with Jordan Stevenson, who's the founder of IHARC, the Integrated Homelessness and Addictions Response Center. And we're going to chat about the response of the County Council last week, who was discussing the reopening or rehashing of a warming / eventually maybe cooling center in the county after the last one was closed in July of this past summer. Staff brought forward a report at last week's council meeting to present 4 different options for the 2025-2026 season. Now there's a growing demand for this emergency shelter and limited capacity across the region. There was 4 potential sites proposed, 2 in Cobourg on Northumberland County property. Basically, the report presented by staff outlines the operational, logistical, and financial considerations for each proposed location, with estimated costs ranging from roughly $215,000 to $400,000, which is the total budget allocation for this winter warming center. But then a 5th option quietly entered the room in the conversation, and you've branded it the Rally Point. It's a proposal, as I mentioned, by Jordan Stevenson here, the founder of IHARC. It really promises this high-tech data collection, accountability, hot meals, and a modular style military-grade tent system, all for roughly 30 chronically homeless, mostly substance addicted individuals in downtown Cobourg. The cost, you said, in that delegation is roughly $280,000, and I believe that was just for a few months of operation, but it's easily scaled up or teared down, which I thought was an important feature of your proposal that I really found to be quite innovative. But right off the hop, we saw the chaos, the disorder, the criminality that was unleashed onto the greater neighborhood with the previous 310 Division warming cooling hub location. Why do you think that this solution will be any different?
So the key differentiators are, first of all, learning from the mistakes that were made in that implementation, the lack of transparency, and just the fact that it was so chaotic and right in the downtown core, essentially. And it looks to mitigate those issues with, first of all, an innovative, tech-centric approach, so using technology to try and mitigate and be, again, more transparent with the implementation of live data, as well as putting it, it's within the one of 2 spots. So County Council decided that it had to be on county land if it was to be in Cobourg, so that's where the spot was proposed, or why it was proposed where it was. But it does put it a bit out of the way, and it focuses purely on getting people working on getting people out of homelessness and addictions and into a more stable environment. So whether that be connecting them with treatment outside of the county or other options, it's primarily there to facilitate that as an exit point, essentially, for people.
And I really liked that you have a hospital tonight approach. That will be kind of the first entering question into your military grade style tent proposal. What does that look like, and what is the feedback, if any, from the hospital in terms of capacity to facilitate that on perhaps a nightly basis? Yeah,
it completely depends. I mean, already as it stands, we're sending people to the hospital when they need it, especially for things like withdrawal symptoms. If they're unable to, and ideally, if they're using illicit substances and they don't want to, we should be providing them an alternative. And if not, then the reasonable expectation is that they're going to seek out more illicit substance and use again. Where if we can divert that to emergency care first, and then look at intaking them to medicine-based treatment, be that Suboxone or methadone, things like that, we can look at then stabilizing the individual and treating them properly. Now, I don't profess to be a medical professional by any means, but It's just simple steps that we can take to try and mitigate these issues. Otherwise, they're going to start withdraw, especially with opioids. They're going to start withdrawing after a few hours. They're going to go outside. They're going to use, or they're going to seek out that illicit fentanyl. They're going to seek out dealers, supply and demand, obviously. So it's going to happen regardless. Mm-hmm. Acknowledging that and then looking to divert that is just a reasonable step. Now, there's I just learned yesterday there's a pilot program in one of the paramedics up in the city somewhere. I guess they're able to administer essentially a withdrawal treatment right on the spot during an overdose. And so looking at innovative solutions like that, where we can take it out of the clinical setting, if it's simply for withdrawal management, and have a dose administered by a medical professional, i.e. a paramedic, we're solving it, and then we can focus on, okay, where do we go from here? Being, okay, let's look at long-term treatment, let's look at housing, things of that nature.
Right. I think my question primarily was, does the hospital, the Northumberland Hills Hospital, have capacity to intake a magnitude of people on a consistent or continual basis?
So it all depends on the night, and I can't speak for them. I know it would be an added stressor. The alternative being we're going to continue to flood the system with overdoses, and even without a warming room at all. Let's look at that example. The healthcare costs associated with that. People don't, 38 people don't just disappear overnight. They're going to be sleeping outside. And even last year with the warming hub, I was calling an ambulance at least once a week for frostbite or cold-related injuries at $1,600. I think the last quoted number was just for an emergency visit per. The healthcare costs alone are just staggering. And for 38 people outside, it's we're going to flood the system regardless with that number, and it's going to be exponentially more expensive than if we can do this in a controlled manner.
Right. Now, the neighborhood, the site that you've proposed, can you tell us a little bit about it? Because it is the paramedics' location, and the neighborhood has expressed concern that this would unleash that similar kind of chaos, criminality, the petty crime, the theft, those sorts of things. What can you say about this site, and what kind of steps you would take to alleviate that kind of risk?
Yeah, so the first approach is a friendly neighbor approach first. That has to be paramount, and done in a transparent way where we are actively looking to stem and mitigate any potential issues. Now, the reason that it was chosen was it was between this building here at County HQ or the paramedic station. Those were the only two available options in terms of what County Council decided. So we're working with a short deck as it is. Now, the reason I suggested that as opposed to this building here is it's more controlled, and we can ideally look to partner with paramedics, where they are, and integrate some level of cooperation and using the community paramedics program. Additionally, with the staff reports, which again they were playing with the cards they were dealt. It involved using the either construction trailers there or their boardroom at the paramedic station. So with this system, we can actually get it off of the grass or off of the pavement, and we can place it onto the grass. So it's just less of an impact as well. But no, the key is mitigating those concerns actively instead of reactively. So instead of having to wait for somebody to call, security as that is at 310. It's active outreach that is preventing, any sort of activity.
Behind basic attendance, which you're tracking, and I want to get into some of your data snapshots in a moment, but how will you define success of this program, this Rally Point initiative, and how will those be tracked and publicly available?
I think the current model of tracking success is mitigating fatalities, and I think that needs to change. I think we need to look at how are we facilitating exits from the overall system, and so obviously it would have to be in conjunction with a number of professionals that are much smarter than I to really come up with what that actually looks like. But in my mind, that success is baseline trends downwards and successfully exiting people from homelessness and addiction. And if that means stably housing somebody, if they are just not facing the complicated issues, if that's intaking them for long-term treatment and there's a success past that, I really think that's what should be the new success metric versus just we didn't have many people die.
Right.
That being said, we shouldn't regress behind that. With nothing this winter, there's going to be fatalities 100%. But I think if we're going to spend that budget, an allocated $400,000, instead of kick the can down the road to spring, where we've ended up with the same issue, if not worse, let's start now in fixing the issues.
And arguably that's a 1 to 2 year plan if we're looking at actually kicking addiction and reintegrating into society, which is kind of above and beyond what you're offering here.
Exactly. And it's there's no one individual silver bullet, first of all, and there's no one individual way to or agency that can fix everything. The police can't arrest the problem away. Paramedics and doctors can't treat the problem away without support of others. The county social services can't do it alone either. It takes a team approach, and that's what's really required here.
I did reach out to County Council, and Warden Ostrander confirmed to me that they haven't decided yet whether or not a warming hub will be available for this upcoming cold weather. So that's yet to come. I believe there's a Tuesday meeting to discuss and finalize that plan on a more kind of emergent basis. But going back to your data snapshots, what have you collected so far? What are you finding as the person that's been on the streets here, I think, for roughly 2 years?
Yeah. So I've noticed it seems to have grown quite a bit the past few months as well. We're looking at, so I believe as of a few days ago, 310 was full with clients, so all their beds were full. So the only shelter beds in the county were taken. And we have 38 individuals, that I counted. So this was a very rapid, just to assess what we're looking at. So there's 38 individuals sleeping outside on top of that. And so it was like 34 beds at Transition House. So you're doubling, the need is double what we have. And so the numbers are growing. So it's insane, first of all. Looking back at Brookside, when the encampment was there, we had, at its peak, 40 people. And now we're looking at 34 plus 38, so it's definitely gone up. And there's a variety of factors, in my opinion, as to why this is happening. It's not just people coming in from out of town, although I've heard that. I know, and I've seen that as well. So it is a factor where social services in other counties and other municipalities, they're stretched as well. I believe Durham just put out a statement a couple days ago stating that about an encampment and shelters being full. And so outreach workers, I know for a fact, are sending people here because unfortunately we don't have the transparency on numbers locally in terms of shelter capacity. So it's all behind the scenes as to whether the shelter is even full. And so there was this big news release about 310 being available and being open, and so outreach workers from other counties are sending people here saying, oh, they have this great thing, when in reality we're maxed out. The other thing is I've noticed a lot of people who are just failing to be able to pay for the cost of living. And that's, not even including the people that I don't deal with, which is, I mostly deal with ones that are, active, out and about, and are not trying to hide, that homelessness, which is understandable. They've been that way for a while. But there's also a number of people that are making active attempts to hide. There's one sleeping in their cars, and so there's a lot of folks that I'm not, even including in that data snapshot, making the number much, much higher. The data that I've collected, it's a staggering number that are involved with opioids and actively using substances and to a dangerous effect. And it's not necessarily that they all become homeless and are addicted, when they become homeless. It's a nature of the environment as well, where I've seen a number of individuals where they've entered homelessness or they've become homeless, and they are, just because of the people that they're hanging around, not saying that it's just the environment. And so they then start using, it usually starts with stimulants like meth, and then it naturally progresses. And it's unfortunate, especially to watch so many different times. And the demographic is younger as well. I mean, it's seen in there. It's not necessarily shown as well, but it's a lot of people, under 30, which is unfortunate.
A lot of young men that I see from the snapshot that you shared.
Yeah.
And there's a lot of criticism that any of these proposed, I don't even want to call them solutions because they're not long-term solutions. And that's where the criticism really lies, is that there's nothing here that's long-term mental health support or drivers to exit that addiction cycle. So I suppose from your perspective, have there been any federal or provincial engagements in terms of expanding the authority or actually funding something like involuntary treatment or facilitating that more longer-term road to recovery?
Yeah, so I believe just this past week there was an email sent out to all the municipalities and counties about the emergency treatment fund, I believe it's called, that the federal government has put out. And so that will look at expanding treatment options. Again, we have the treatment options locally, and this is going to be a common criticism, is that the treatment beds are available locally through the treatment bed program, which I'm not coming out to criticize and say, you know, that's not a good thing. It's a good program. It's good in theory. I think the people behind it put a lot of work into it. The problem is, you know, we don't take a cancer patient, cure them of cancer, and then throw them into an asbestos factory. And that's essentially what we're doing by not following through. You know, they go to the 30-day treatment program at $30,000 a pop, but then they're not provided the aftercare. It's not full circle.
Mm-hmm.
It's
the wraparound supports that you hear so much about, but then fail to actually see tangibly implemented.
Yeah, and you know, we're expecting people to then either go to 310 or just back into homelessness, and then we wonder why they relapse, or they wonder, you know, why that didn't work. Well, that's why, you know, I'm not actively, you know, unless somebody specifically asked me about it, it's not something that I actively, you know, try and seek out individuals for, specifically because it's fiscally irresponsible in my mind. It provides somebody 30 days of treatment and then is arguably more dangerous because they're coming out, if they complete the program, they're sober, come out in the exact same environment. If they use again, their tolerance is 0, they're more likely to relapse. It's the same as jail.
And overdose.
Exactly.
Yeah.
And so it's not something that is, you know, conducive to long-term success. That being said, there have been successes. It's just the successes are usually people that are already housed or have, you know, accommodations afterwards. Exactly. Mm-hmm. So I'm not knocking the program. It's just that's why we're not seeing the success metrics from that program for the demographic of people living outside. It's just everybody that I've sent through has relapsed.
Anecdotally, that's worth something. Just kind of in closing, Jordan, what is your message to County Council? You know, they're responsible for overseeing 90,000 residents in the county, and there's, you know, 30 to 38 people that are taking a hefty budget allocation for this need. How do you anticipate the county will justify if they move forward with a warming hub?
So the alternative is, and you know, to flip it around, what is the cost if we don't? And like we talked about earlier, the healthcare costs, the cost to Cobourg taxpayers in terms of policing, just the sustainment cost for an individual living homeless is just insane. And so if we're going to spend that money, spend it on something that will help solve the problem instead of just sustaining. It's going to continue to get worse, and we're going to continue to spend even more taxpayer dollars on sustainment, and that's something that's out of their control in terms of healthcare costs or policing costs. You know, you can't go down to the street and say, oh, you're not allowed an ambulance because, you know, you've taken too many. They're going to get one. Mm-hmm. And, you know, you have people that are going to the hospital on a regular basis, and just those costs, it's got to be upwards of $100,000 a year per individual just to sustain homelessness. And so if we want to buck that trend, we have to start working on solutions now, and that includes figuring out something that ideally will look at not just providing a warm space, but also providing an exit from homelessness.
Well, thanks so much for your time, Jordan. Really appreciate it, as always.
Thanks.
And for Rebel News, in front of the Northumberland County Building in Cobourg, Ontario, I'm Tamara Ugolini. FixOurCities.com is where you can find reports on this topic and consider supporting this kind of journalism. If you're interested, check out more at FixOurCities.com.